This show is for informational purposes only. This does not substitute for medical or professional advice. Instead, always get the advice of your medical professionals. I am expressing my own views, and these views do not reflect any employer, past, present, or future, or any of their representatives.
Why are so many men lonely? Before somebody says everybody gets lonely, that's true. Women experience loneliness. Older adults experience loneliness. Younger people experience loneliness. But what caught my attention was that loneliness has become such a significant concern that in 2023, the U.S. Surgeon General issued a national advisory on loneliness and social isolation. Think about that for a second. We hear advisories about smoking. We hear advisories about obesity. We hear advisories about infectious diseases. Yet loneliness became important enough to receive a national husband, father, as a healthcare worker, provider, a working man. I started to think about that because I think many men have people around them, but they still feel disconnected. And maybe that's a conversation worth having. Friendship was easier. Whenever we were kids, friendship developed a whole lot easier because you had school friendships. I mean, you were in 8 hours in a day. You had sporting events, even if someone didn't play sports, maybe around the community. Those allowed for friendships to occur, to build, to grow. Church friendships are cherished there. They have a chance to grow, to blossom. Neighborhood friends. Neighborhood friendships grow because you're neighbors. You live close to one another. Summer vacations, once again, helps things grow. Friendship is a whole lot easier whenever we were kids. Hanging out without planning. For the good days. Friendship used to happen automatically. I mean, just think about it. Riding bikes. Remember my experience. I'm sure I'm not the only one. I had some friends that used to ride, I don't know how many miles, but I remember we used to ride the bike past the house that had the dogs that would come chase us. Boy, if we fell off them bikes, we'd be in bad shape, but we never did. Playing basketball. I mean, we used to have a basketball game. I mean, if it wasn't every weekend at one location, had more basketball games that was on the weekend, but it had basketball games in the community on the weekdays and the weekends. Video games. Some children nowadays, the video games really have become the replacement of playing basketball, playing sports, and riding bikes. But video games is still an opportunity to cherish friendships. And think about it, as a child, men had more time to play video games, generally speaking. So spending entire afternoons together, shoot, the whole day together. I remember, it just seemed like time back whenever we were kids, right? I mean, I remember some of my best buddies would come over like 1 o'clock, noon. I mean, and I don't know if they left at 6 or 5. I don't know when they left. It was forever, I don't think me personally, I didn't have a realization of the time. I mean, we used to have sleepovers, in fact. Think about all the time we had then. So, I mean, those things just make relationships grow. Now, that to adulthood. Adulthood is completely different. And yeah, I know, I get it. Someone say, well, I used to work whenever I was a kid. Okay, that's cool. No worries. So did a lot of us. But as an adult, work is pretty different for the most part than work as a kid. Or at least that's my experience. Marriage. Getting married, now you're Now now you're one. So it used to be just you, and now you're dealing with, your other half. And so those friendships, the time just isn't there. That's like your number one friendship. Children take time. They take a lot of emotions, a lot of support. The work that you're doing it for your children. Other responsibilities. I mean, as a child, the responsibilities was not there. I mean, even if I worked, I didn't have the amount of responsibilities I have now. And as a result, friendships, they can't blossom like they did as children. See, most adult friends don't disappear because of life. Men build lives, but sometimes they lose connection. So, men build careers, right? Whatever the career is, it takes a amount of sacrifice. I remember whenever I was not a nurse yet, I was actually a unit secretary, and I got into nursing school. And I actually missed my cousin's graduation. Big deal for me because I really wanted to go to her graduation, and I felt some kind of way about not going. But I remember what one of the nurses told me that day. And she said, to be a nurse, you're going to make a lot of sacrifices. And she told me the truth. As I got older, I still ponder that nowadays. As a 42-year-old man, I think about make sacrifices for your careers if you didn't have that career. So that's true. Providing for the family, it takes a piece out of you. So perhaps the time that you do have, it's a lot of recuperation. And if not mentally, physically, or maybe a combination of both. The time that was off, well, now that time is really spent. And so that's something to think about. Fatherhood, once again, having children, other responsibilities. Like I said, just exhausted. And so many men become so busy building a life that they stop building friendships. So my observation is this. I work a 7-day on, 7-day off at the company I'm with now. And it's a great schedule. As a provider, I really do. But I look at some of my colleagues, and I worked a 5-day-a-week job, before as well. The level of responsibility as a provider can become overwhelming. It truly can, because you really do spend a lot of emotional baggage that with the responsibility of being a provider. So it's not necessarily the medicine. It's not necessarily that. It's not necessarily the education, but just the emotions that you're dealing with. It takes a lot. It truly does. And so that, so when working, it can truly make not only myself, but anyone. After all of that, you get home and guess what? You're tired, right? And in some cases, lots of times in healthcare, it doesn't stop whenever you get home, right? It doesn't stop. Your provider has a lot of responsibility in order to finish charts, close it in an appropriate amount of time, right? So, so there is an alignment there with the processes of, any company, wherever you work, you're going to face that as a provider. So it doesn't matter really. Yeah, it does. You're off, but you still have that responsibility to, complete the necessary work, even when you're off. There's their own salaries. So we're fame. And I think honestly, a lot of, my personal experience, understand that concept. And if I wasn't in it, I might not understand it either. The idea of the job went off and, you're not getting paid for it. And it's not hour by hour compensation, it's actual salary. So, and then you throw that exhaustion with the family responsibilities. And one big responsibility is childcare. And God forbid if somebody in the family gets sick, which we deal with frequently. The amount of time children get sick and then they bring that into the home and the other child gets sick, the families get sick. Before children, I can't remember having all the viruses, respiratorily and gastrointestinally. it seems like it takes a couple of days for it to pass through, whatever it is. And so all of that, those responsibilities, and you had church responsibilities, obligations, things need repair, then the man or woman, but somebody's got to take care of it. And so think about this, these responsibilities take a turn. It takes a toll on what we're talking about today is men. And as a result, one day of not contacting someone turns into 1 month. Then 1 month turns a year. And then suddenly you realize you haven't really connected with a close friend in a very long time. And God forbid that time can lapse, and frankly, people die. I can think of 2 of my best friends growing up as a kid. So it takes a lot, and you didn't. And so just think about that opportunity to spend that time with them. You never get it back. So loneliness is more fulfilling. Because this is not just Nurse Tad that's saying these things. No, this is actually well documented. Once again, just a couple of references. The general advisory, the one I was talking about back in 2023. The reason this caught my attention is because healthcare is increasingly that loneliness as more as an emotional issue. It's becoming recognized as a health issue. It's becoming recognized as a health issue. And so it's not just some type of emotional issue that we're dealing with. No, we're talking about a health issue. And so once again, just think about that. Surgeon General offers is on consumptions, tobacco consumption, disease consumption. So significance of advisory about loneliness is just as important as anything else. And so your mental health is just as important as physical health. It all goes together. Reference to social isolation and mortality. Researchers, they've found that association between chronic loneliness and social isolation have increased mortality risk, and this is a finding. As this article here I was just reading, and this is an article by Z. Lee and other authors, and I access this article, Loneliness, Social Isolation, Health. It says molecular mechanisms responsible for increased cardiovascular risk, they're poorly understood, were associated with activation of hypothalamic, pituitary, adrenocortical axis, sympathetic nervous system. Repeated and social stress leads to glucocorticoid resistance, enhanced myelopoiesis, regulated pro-inflammatory gene expression, oxidative stress. However, the causal role of these mechanisms, development of loneliness-associated cardiovascular disease remains unclear. In layman's terms, what this is saying is that this loneliness affects the heart system, the cardiovascular system, but it also affects the pituitary and the hypothalamic adrenal axis. So essentially all hormones, or a good chunk of them, they're all affected. The stress hormone, cortisone, is affected with that. Resistance is affected with that. Pro-inflammatory gene expression, and then oxidative stress. So, essentially, caused by there is a link between loneliness and these significant medical problems there. And now the question, once again, just looking at that article, the research doesn't give the clear answer why that's occurring, but they did notice the link between the two. And so here's what the key point of this is. The body doesn't always distinguish between emotional and physical stress. We often think about diet and exercise when we discuss health, but we don't always think about relationships when it comes to health. Why don't men talk about this? Why do men talk about sports easier than loneliness? Why do men talk about work easier than loneliness? Why do men talk about finances easier than loneliness? Pride could be one of the reasons why men talk about these type of things less. Okay, independence, masculinity, a fear of burdening others. Those are some of, or could be some of the reasons. A lot of men would rather admit they're struggling financially than admit they're lonely. Many men are carrying burdens nobody knows about. I mean, it's stressful. Nowadays, it's a very stressful time to exist. And make no mistake about it, it does affect the ability to nurture and to sustain and to grow relationships. I mean, we were talking about earlier as kids, the difference between that and adults, just the amount of time that was there to grow a relationship, because it takes time to grow a relationship. You know, you might have a brief moment of alignment between ideas and thoughts and personalities, but still it takes time to grow, right? And sometimes even, fallouts occur, but that's still a part of the growth. And it's difficult when you're adult because you're facing so much pressure, because you got career pressure. So so you got that kind of pressure, you got fear. And then you got your own emotional issues, your own emotional isolation, your own emotional pressure. And don't forget, medical issues that might cause a person to not be able to dedicate the type of time it takes to a relationship. So being connected isn't the same thing as known. Now, nowadays, with social media, it's relatively easier thing to be connected. Not necessarily known, be connected, because there's so much social media out there. So easy to turn on the apps and to just scroll rather than actually being known. You got group chats, which exist, and to be useful, no doubt about it, especially with topics that, really interested in. And maybe their friend isn't really interested in that topic, but to have that group chat available, it truly is it can be useful as a tool in order to express feelings, capture knowledge about a certain topic. But are you known on that group chat, on that social media? Do people know you? Username, but do they know you? People can easily text. Instead of calling, they can text. But can you capture every emotion on a text? And sometimes that's a good thing. Sometimes you don't need to have necessarily all the emotions expressed, but know you through text messages, online connections like we discussed. So being connected, what about with some people have so many followers, and so on social media, but are they really known by those followers? Are really, as a influencer, most times you're influencing a specific idea or specific knowledge or specific that people want to follow, they want to know about. But behind that, there's still the you. So is there more to it? And so once again, the connection isn't there. So, being connected isn't the same thing as being known. Technology gives us communication. It doesn't automatically give us connection. So is loneliness the healthcare risk we ignore? Here's what fascinates me. If someone smokes cigarettes, we immediately recognize that's a health concern. If someone never exercises, we recognize that as a health concern. If someone eats poorly every day, we recognize that as a health concern. But if someone hasn't had a meaningful friendship or genuine connection in years, we don't often think about that as a health issue. But maybe we should.
And honestly, what I just discussed here about those obvious findings, it doesn't take a healthcare provider to raise that concern. But the suggestion is, does it really take a provider to realize the emotional concern if someone hasn't had a emotional connection with someone in years? Does it take a healthcare provider to point that out? Research continues to suggest that meaningful social connection is protective for mental health and overall well-being. So what do we do about it? That's a practical thing. That's some type of men's group. Men can talk. And, maybe men can just call, other men every once in a while. Hey, man, let's call and say hello. Hope you're doing all right. Just a little bit of concern. That might mean a little something. What about whatever your church opportunities that you have? You perhaps use that. You might have an opportunity to gain a friend, have support. And I was telling my daughter today, doesn't have to be the same age. In the Bible, David and Jonathan were on different ages, but they connected. They were loyal. They were friends. And so maybe some type of hobbies. So if you have a hobby, maybe use a men's group or something to find other men that perhaps have the same type of hobbies. Volunteering is a way that you could use to connect. And then reaching out intentionally. So once again, just that intentional call. I just let them know, hey, I intentionally called you. And, lots of times my experience is, you get calls from guys or men and the immediate red flag pops up. Okay, something's wrong. There's some type of issue. But man, it feels good when it's not that. It's just, hey man, how are you doing? Just wanted to call and say hello type of thing. That truly does mean something. Even in the business of day, just that little reflection helps. So friendship in adulthood doesn't happen automatically anymore. It happens intentionally. So what's the tad bit takeaway? One thing I've realized as I've gotten older is that friendship doesn't happen the same way it did when we were kids. Life gets busy, careers happen, marriage happens, children happen, responsibilities grow, and before you know it, years have passed. But human beings still need connection. We still need community. We still need people who know us beyond our job titles and responsibilities. The more I learn about loneliness, the more I believe relationships aren't simply a luxury. They are a part of health. Maybe becoming just a tad bit smarter means recognizing that success means very little if you have nobody to share it with. And maybe the strongest thing a man can do isn't pretending he doesn't need people. Maybe it's recognizing that he does.